Childbirth is not one event. It is not even one day. It is a slow, unavoidable progression where your body keeps advancing while your mind repeatedly falls behind. People remember the pain. They forget the waiting, the not knowing, the way time stretches until it loses meaning. Birth doesn't happen to you. You're carried through it, whether you cooperate or not. Before labor. Long before labor begins, your body starts acting differently. You notice it when you walk, your hips feel unstable, your steps shorten, your posture shifts without asking. The baby drops lower, breathing improves, but pressure increases. A constant weight rests deep in your pelvis. Sitting becomes uncomfortable. Standing is worse. Rolling over in bed requires effort. You pee constantly. Sleep fractures into short, shallow pieces. Your back aches, not sharply but persistently, like something slowly loosening inside. Braxton Hicks contractions tighten your abdomen suddenly. They stop just as abruptly. You are told they don't matter, so you try not to believe them. Emotionally, you become restless. You organize things that won't matter later. You clean the same surfaces repeatedly. This isn't productivity. It's anxiety looking for a job. Your cervix softens, thins. You can't feel that part, but your body can. Something irreversible has started. Early labor. Early labor doesn't feel like labor. It feels like confusion. A cramp appears low in your abdomen. It fades. Another arrives. You pause what you're doing. Is this something? The contractions don't follow rules. They arrive every 15 minutes, then 20, then closer, just to disappear again. They feel like strong menstrual cramps, or a backache that wraps around your hips. You can still talk, still walk, still doubt. And doubt drains you, because you are constantly calculating, is this real yet? Am I overreacting? What if I go in too early? Your body starts emptying itself. Diarrhea, nausea. This isn't sickness. It's preparation. Pressure builds low in your pelvis, a heaviness that doesn't lift. Then, the mucus plug releases, thick, sticky, streaked with blood. It's unsettling, a reminder that something internal is opening. Sleep becomes impossible. You lie down, then get up. You pace, you rock, you breathe. This phase can last longer than everything that comes after it. 12 hours, 18, 2 days. The pain is tolerable, the waiting is not. Early labor teaches you patience by denying confirmation. Active labor. Eventually, the contractions stop asking politely. They arrive with intent. Every 5 minutes, then 4, then 3. Each one tightens your abdomen so hard your breath catches without permission. Your body folds forward instinctively. The pain now has weight. It wraps around your back, your hips, your pelvis. It builds slowly, peaks sharply, releases just enough to let you recover. Then it comes again. Your cervix opens wider, muscles stretch, ligaments strain, your baby presses downward, your legs tremble, your jaw clenches until your teeth ache. You sweat, then suddenly shiver. Time becomes unreliable. One contraction feels endless. The break between them feels cruelly short. You stop thinking ahead. Your world shrinks to a single goal. Get through this one. Support becomes essential. A hand pressing into your lower back. A voice grounding you. Without it, fear grows. Pain relief may arrive. An epidural dulls sensation. Medication softens edges. But even numb, your body continues the work. Back labor changes everything. If the baby faces upward, pain drills directly into your spine. No position offers relief. You begin to feel trapped inside your own body. This is endurance. And still, this is not the breaking point. Transition. Transition arrives without warning. Contractions collide, 2 minutes apart, sometimes less. Each one overtakes your entire body. There's no rest. Pressure builds deep and low, a relentless force pushing downward. Your body begins pushing on its own. You may try to resist. You can't. Burning spreads through your pelvis. Your stomach lurches. You vomit. You shake violently. Your hands clutch at anything solid. Your voice cracks. This is where people say, I can't do this. I'm done. Something is wrong. It feels true. Your brain panics. Fear spikes. Fear of tearing. Fear of surgery. Fear of losing control completely. Adrenaline floods your system. Your thoughts fragment. Language becomes difficult. This phase is short, but subjectively endless. Every second stretches heavy and thick. Then, without warning, your body shifts again. Pushing. The urge to push is overwhelming. It is not optional. It feels exactly like needing to expel something enormous. and stopping is impossible. Your body bears down, hard, again and again. Your lungs burn, your face strains, your vision narrows. The baby descends slowly. The head appears, then retreats, again and again. This repetition is cruel. Then comes the fire. Crowning, skin stretches beyond tolerance. The burning is sharp, consuming, focused. This is where tearing happens. Pain peaks, then transforms. Once the head emerges, pain shifts into pressure. One more push, the shoulders rotate, the body slides free. Suddenly, emptiness. Relief hits faster than expected. A cry fills the room. Everything stops. How the baby arrives. Vaginal birth. Vaginal birth is often called natural. That word is misleading. Natural does not mean easy. It means unassisted by surgery. The baby moves through a space that slowly reshapes itself under force. Bones shift, muscles stretch, skin thins under pressure. Hormones flood the body during this process. Oxytocin intensifies contractions, but it also floods the brain afterward, creating bonding, attachment, and emotional focus on the baby. Endorphins rise during labor. They do not erase pain. They blunt it just enough to keep you functioning. After birth, recovery often begins faster than with surgery. You can stand sooner, move sooner, hold your baby without restriction. But the cost is paid earlier. During labor, tearing is common, sometimes superficial, sometimes deep. The pelvic floor absorbs enormous strain. For many, healing is straightforward. For others, weakness, pain, or incontinence lingers. If labor is prolonged, exhaustion becomes its own injury. And sometimes, despite everything working normally, vaginal birth still ends in emergency surgery. Pain during labor is intense, but for many it falls away quickly once birth is complete. The relief can feel sudden, almost shocking. Assisted vaginal delivery. Sometimes the body stalls, not because it failed, but because it is exhausted. Hours of pushing can drain every reserve, or the baby begins showing signs of distress. Heart rate changes. Oxygen drops, or medical conditions make prolonged pushing dangerous. In these moments, assistance is offered. Forceps or a vacuum are used to guide the baby's head. Not pull the baby out violently, but help redirect force already happening. Pressure increases dramatically. The sensation is intense. Risks rise. Tearing is more likely. Swelling can occur. Babies may be born with temporary marks or bruising. In rare cases, nerves are affected. If assistance fails, surgery follows. Emotionally, this type of birth can feel confusing. You did not stop labor, but you did not finish it alone. Some feel relief, some feel disappointment. Both reactions are common. Cesarean section, aka birth by incision. A cesarean section is not a shortcut. It is major abdominal surgery. Sometimes it is planned. Often it is decided quickly. Reasons include the baby positioned sideways or feet first, the placenta blocking the birth canal, labor that stops progressing, signs the baby is in danger, maternal emergencies. During surgery, you feel pressure, pulling, tugging, but not pain. The baby is delivered within minutes. Then the surgery continues. Layers of muscle and tissue are closed carefully. Recovery begins immediately and lasts far longer. Pain is delayed, not avoided. Movement is restricted. Standing hurts. Laughing hurts. Coughing hurts. The incision burns, pulls, and aches. Infection risk is higher. Future pregnancies carry additional considerations. Babies born this way may initially struggle to clear fluid from their lungs because they did not experience compression through the birth canal. Emotionally, reactions vary. Some feel relief. Some feel grief for the birth they imagined. Both are valid. Immediately after birth, you're shaking, cold, disoriented. Your baby is placed on your chest, warm, wet, lighter than you imagined. Oxytocin floods your body. Some people cry immediately, some stare silently, some feel numb. All responses are normal. Your uterus contracts again. The placenta detaches. A warm rush of blood. Compared to labor, this feels minor. Stitches may come. You feel tugging, pulling. Exhaustion settles into your bones. Your muscles finally relax. The hours after birth. Pain doesn't vanish. Your abdomen cramps as the uterus shrinks. Your perineum stings. Your body feels bruised everywhere. Hormones crash. Emotions spike unpredictably. Joy, fear, relief, grief. Sleep disappears. Your mind replays everything. what scared you, what hurt most, what you didn't expect. Birth leaves an imprint. It does not fade quickly. Factors that change every birth. First birth versus later births. First labors are usually longer. The body learns the process the hard way. Later births often move faster, and sometimes shockingly fast. But after pains can be stronger. The uterus contracts more forcefully after delivery. Induction. When labor is started artificially, contractions often come faster and harder. Pain can feel more abrupt. Medication needs increase. Labor may feel less gradual, more aggressive. Support systems. A calm voice. A trusted presence. These reduce fear, which directly reduces pain perception. An unsupportive or rushed environment does the opposite. The undisclosed realities. Labor can involve vomiting, bowel movements, loss of bladder control. Pain ranges wildly. Some describe it as manageable, others as overwhelming. Some births feel empowering, others feel traumatic. Recovery takes weeks, not days. Emotional vulnerability lingers. Baby blues are common. Postpartum depression is real. None of this means failure. It means the body and mind went through something extreme. The truth that can't be shortened. Birth is not defined by pain alone. It is defined by duration, by loss of control, by endurance without certainty. Some people feel empowered, some feel traumatized. Both are real. There is no perfect birth. There is survival, a safe mother, a living child. Everything else is secondary. And when it's over, a completely new story begins.